our next guest, Angie Menino from Inova Health. So last time I'll say this, and I know I'm being redundant with it, but it's all about how this organizational change impacts the company, right? Mm-hmm. So now it's worked its way all the way through these different levels, and now it's about to impact the customer. And for you, the customer are your patients, right?
Right.
So, and maybe it sounds too obvious, but tell us why it's so important to take care of the customer, the patient at Inova. Well,
there's a couple things. The first thing is to understand that when we have patients in our hospitals, it's generally people that are not happy to be there. They're scared. Right. They don't know what's going to happen to them. So from the perspective of a patient receiving care, I need a caregiver that's able to be empathetic and compassionate and actually take a step back and put themselves in the patient's seat to deliver good care. Right. The other thing that's happening in healthcare is it's highly competitive. So patients now, they have choices. They don't just have to go to my hospital. They can go to my competitor's hospital. So if you look at caregiving, if I'm a patient, I expect to be healed or at least made better, somewhat better. What differentiates us is the care where where the caregiver has anticipated my needs, they were compassionate, they were kind, they made the whole experience for me and my family much better. And so that's where we have to focus on today.
Right. So I guess I would say maybe part of the change that kind of made you guys decide to bring in People Answers was the fact that, yeah, you do have these ratings that are out there. So if I'm going to the hospital now, I can look online and go, nah, I'm not going to go there because their rating's not so great. Oh. So kind of the business side and the human side of healthcare. So is that the challenge for you guys?
The human side is probably our first focus because our patient promise, and we don't advertise this or tell families this, but this is what we talk about internally, is we want to meet the unique needs of each individual we are privileged to serve every time, every touch. So that is our first focus. But the reality is there's a business impact to good customer service in healthcare. Medicare and Medicaid in the future are going to base their reimbursement on your patient satisfaction scores. So we better have good scores because not only is it going to impact our bottom line with how we get paid and how much we get paid, it's public. So patients can go on the CMS website, that's the Medicare and Medicaid governing bodies, and they can see how each hospital has been rated. And you also have the open-ended internet. You can go on lots of sites. There's many, many sites that you can rate different aspects of healthcare, be it your doctor, your radiologist, did you have a procedure? So everything's public now.
Okay. So human side, business side, how does People Answers, or how has People Answered help Inova meet that challenge?
Well, what we do now is we assess our employees on their caregiving skills, and it's the softer side. It's really easy to evaluate somebody clinically. I can tell if somebody can intubate somebody. I know what types of degrees they have. I know what types of experience they've had. What I can't tell you is this somebody that can be very compassionate and care about a patient and own the patient experience, anticipate their needs, really have concern and be the advocate for that patient. People Answers helps me get to that.
Right. So my wife is an operating room nurse, and so I know having the right fit and being, just because she's my wife, I know her really well. I know
I hope so.
Well, it's a good point. Wow, yeah, it's a very good point. I know she's where she needs to be. She loves it, but maybe not so much in another area. So any insight on that? It's kind of what you're.
We actually use People Answers for transfers in nursing to different modalities, and your wife brings up the perfect example of what we see day in and day out. If you are an operating nurse and you work in the OR, you are used to structure, consistency. There's a lot of protocols. There's checklists and protocols. Just like when you get on an airplane, the pilot's going through his checklist. That's what we do in the OR. There is a escalation process where if something's going wrong, anybody in the OR can do a surgical pause and stop the surgery. So you're in control of your environment at all times. So people that like that quality, safety, consistency, analytical people really like the OR. And oh, by the way, your patients are sedated, so you don't put up with anything from patients. So
only doctors, right?
Only doctors. You just got to make the doctors happy. Well, we have nurses, they get tired of the OR and decide that they want to be more of the nurse, the real nurse, and want to transfer to a med-surg floor. Med-surg is just the normal run-of-the-mill nursing store. You're not, you're not in critical care, you're not in the OR. Well, anyway, they get to med-surg. All of a sudden, every patient is different. Patients have 70 family members in visiting them. Patients have no family. Patients fall. Patients don't listen to you. Patients complain. They ring their call bell all the time. They want water. They want change. They want you to change their TV channel. It's a chaotic, different environment.
Right.
So nurses have to have those, empathy, compassion.
Sure.
You got to understand the patients in pain. You got to apply those behaviors, and a lot of them can't make that change. They can't go into that different level of care. People Answers has helped us find that in the employees that transfer. So we've had a much higher success rate with our transfers.
Right. So because we built profiles across nursing modalities for you, right? So if I'm OR and I want to be med-surg, complete the People Answers if I haven't done it already, and you can see, do I fit, do I not fit, am I going to be able to make that transition, right?
Exactly.
Now, you've also got nurses who want to move to that nursing manager position, and I think you're using us there as well, right?
We are. We're using it for every nursing leadership position. And the reason that we do that, and it's very important for us to have the right fit for a leader, is if you think about caregiving, it's stressful, it's taxing, they work 12-hour shifts. It's a hard job.
Right.
If you have a supervisor that's bad, it makes it difficult for you to be the person you need to be as a caregiver. So it's very important to us that we have the right leaders managing our nurses.
Right. And I know for a hospital, and for everybody really, but certainly for a hospital and a caregiver, retention is a big deal, right?
Yes.
You got travelers and you got things like that. So what are your thoughts on that? I mean, anything extra to share there? Or?
One of the ways that we sold the People Answers concept to our executives was to talk about retention and the importance of no turnover and no vacancy duration. In healthcare, turnover and vacancies really hurt you from a patient experience perspective. Our best nurses are the ones that have been around a long time. They know how to access supplies. They know how to, if the patient needs to have an x-ray, they know exactly who to call, how to get that done. They know the system. They know the doctor preferences. It makes the whole value and quality of care so much better.
Right.
When we have vacancies, we do one of two things. One is we tap into overtime. So we ask a nurse to take on an extra shift. Now you're dealing with somebody who's had 3 12-hour shifts, and now you're going to ask them to take a 4th. Well, they're not the happiest. They're tired. They haven't had downtime. They need their time to recharge and rejuvenate themselves so they can be good caregivers.
Right.
Our second choice, which is really, really expensive, is to hire travelers. And all travelers are temporary nurses that travel across the United States, and we use them to fill vacancies temporarily. Well, travelers don't know your language. They don't know the system. They don't know the docs. So travelers are always, the care is slower. They're not as responsive. They haven't had a People Answers assessment, so they probably really don't match what we're trying to create in our culture, so there's issues with that. And all around, there's a degradation in care when we use travelers. So our best solution is not to have vacancies.
Right, and if you're using a traveler, that again goes back, hits that bottom line.
Oh, definitely.
Because
My turnover to fill a vacancy for just a staff nurse is 44,000. For some of my specialists like ORs, or if you go into anesthesiology, it can be upwards of 100,000.
Right. Good, and that's probably a good segue. I think we've got some results. We've been live long enough to study, so you mind telling us a little bit about the results you've had?
We've had a really good reduction in our turnover, and we measure turnover in nursing. We look at 1-year turnover, and then we look at overall, and both have had a reduction. Your 1 year is really your indication of a good fit. Did you identify a candidate that's a good fit for this role? Because I'll tell you, in nursing, if you get there and it's a bad fit, you're gone. Because you're scared, you don't want to kill somebody, and you're not happy in your profession. So we've seen a reduction in that. We've seen a reduction in our vacancy rate. And the really nice thing is we do a survey, we call it the New Joiner Survey, and we survey new hires, new joiners, who have been with us 30 days, 6 months, and 1 year. So you take the survey 3 times. And what this survey does is it asks you about your work environment, your satisfaction with Inova as an employer, your satisfaction of your supervisor, and did we live up to the promises we made when we hired you? And we're seeing great results in that. We had pretty bad scores to begin with on that, and we're seeing a big improvement. And I think People Answers is a lot of that.
Wow, that's great. I think you've got some takeaways for us that maybe you were going to run through real quickly.
We do. Don't underestimate the importance of your turnover and vacancies and how they're impacting what your company is trying to achieve.
Right.
The other thing I would say is, retention in our industry at least drives the customer experience. If we're in these huddles saying we want to meet the unique needs of every individual we are privileged to serve every time, every touch, we better be delivering upon that. And retention is a big driver of that.
Right. Okay, very good. So you have a video that you brought with us, or brought with you? You're going to share it? You want to set this up a little bit?
The video that I brought is one, when we developed our experience, the promise, meeting the unique needs. When we went out and started sharing that with nurses, what we wanted to do is bring them back to the emotional connection they had to their mission, the mission of nursing and their career calling. Because a lot of nurses view it as a calling. This isn't a job. This is something that they have known that they wanted to do since, they were 1 year old.
Right.
But anyway, so this video was developed as an opener when we were communicating our new patient promise. So that's
Good.
what you'll see.
Okay.
If the storm clouds appear and the skies turn gray, you don't need to worry, I'm just a step away. Sometimes things get rough and you need a good friend. Take hold of my hand, it's by you that I stand. And if the days turn to night and things just won't go right, we're together forever, we'll find the light.
If you come to one of our hospitals, the most important single thing is no matter what, we're going to be there. That's at the heart of what we do. And that's the true definition of commitment.
Very good. Good video.
Yeah,
Really,
it is.
really good video. Thanks for being with us today.
Thank
We
you.
appreciate it. Thanks for kind of telling us how, you guys have kept the customer need front and center on everything you're doing. We appreciate it.
Very good.
Thanks, Angel.